Welcome, future New Zealand animal care professionals. As your Level 3 animal care tutor, I'm absolutely thrilled to guide you through today's explainer. We are mastering a really crucial topic for your upcoming Unit Standard 19894 assessment, Toxoplasmosis. And look, this isn't just about passing a test, right? It's about keeping yourselves, your clients, and the animals you care for totally safe from a very serious zoonotic disease.
So let's kick things off by testing your baseline knowledge with a question that, hint, hint, might just show up on your exam. Think about all the pathogens we've discussed so far in class. What zoonotic disease reproduces only in cats but can somehow infect almost any warm-blooded animal?
If you guessed Toxoplasma gondii, you hit the nail on the head. This little guy is a widespread microscopic single-celled protozoal parasite. When a host gets infected, this protozoan forms cysts that can literally affect almost any part of the body, particularly the brain and muscles. But the absolute key takeaway you need for your assessment is this. It relies exclusively on the feline intestine, the cat, to sexually reproduce before it spreads out to other hosts.
Okay, here's our educator's blueprint for today. We'll be looking at an Intro to Unit Standard 19894, the Toxoplasma life cycle, symptoms and human risks, prevention and environmental control, PPE and general hygiene, and finally, managing exposure and symptoms.
Section 2, the Toxoplasma life cycle. Let's unpack the mechanics of how this parasite actually survives and spreads in the environment.
It's kind of like a bizarre biological relay race. Cats, acting as the definitive host, usually get infected by eating intermediate hosts, like mice or birds, that already have tissue cysts in their muscles. The sexual reproduction of the parasite then happens right inside the cat's intestine. After that, the cat excretes unsporulated oocysts in massive numbers in their feces. Now, fresh cat feces are unlikely to present an immediate risk because those oocysts haven't sporulated yet. But give them about 1 to 5 days out in the environment, and they become infective sporulated oocysts. And get this, they can survive in moist soil for over 12 months. That's a whole year just waiting in the dirt.
So how do intermediate hosts, which includes us humans plus sheep, dogs, and mice, actually catch it? Well, transmission primarily happens through these 3 main routes. First up, eating tissue cysts hiding out in undercooked meat. Second, accidentally ingesting those sporulated oocysts directly from an environment contaminated with cat feces, like your garden soil. And third is transplacental transmission. This happens when a mother acquires the infection for the very first time during pregnancy and unfortunately passes it right to the fetus.
Section 3, Symptoms and Human Risks. Now that we know how it spreads, let's contrast how this looks in animals versus humans.
You'll definitely want to keep these comparisons in mind for your exam. While most infections in animals are actually subclinical and you'd only spot them on a blood test, the clinical signs can sometimes be severe. In sheep and goats, it can cause devastating abortions and perinatal mortality. Dogs might suffer from encephalomyelitis, displaying convulsions or even paralysis. Now in humans, an acquired infection might just feel like a mild flu with some enlarged lymph nodes if you're healthy. But a congenital infection? That can lead to birth defects, really severe ocular issues like blurred vision, and even mental retardation later in life.
And that brings us to an absolutely crucial point. While a healthy person might just brush off mild symptoms that resolve on their own, the clinical effects are incredibly serious and often fatal for a developing human fetus and for immunodeficient individuals. For someone with a weakened immune system, the infection often targets the central nervous system and can cause severe encephalitis. It's no joke.
Section 4, Prevention and Environmental Control. Understanding those severe impacts leads us directly to our shield against infection.
Because of those severe fetal risks we just talked about, there is incredibly strict guidance for folks at the highest risk. Pregnant individuals have to take special precautions. This means completely avoiding changing litter boxes, if at all possible. If they absolutely have to do it, they must wear disposable gloves and wash up thoroughly right after. They should keep cats indoors, steer clear of stray kittens, and critically, this is a big one, cook meat thoroughly to at least 66 degrees Celsius. That is the only reliable way to destroy those tissue cysts.
When you're out in the field on a New Zealand farm or working in a busy vet clinic, your environmental controls have to be dialed in. As future animal care pros, you need to advise farmers to keep young cats entirely out of hay barns and sheep food stores. You should also know that yes, we can actually vaccinate sheep against toxoplasmosis to prevent those awful abortions. Always, always keep gardens and kennel runs totally clear of feces. And make sure outdoor children's sandpits are tightly covered, because remember, those oocysts can survive in that sand for a very, very long time.
Section 5. PPE and General Hygiene. Let's transition to managing your personal safety with the exact standards required for Unit Standard 1989-4.
These rapid-fire hygiene rules are absolute non-negotiables for your career. You must wash your hands thoroughly after handling any diseased animal. Never ever allow animals to lick your face or mouth. I know it's cute, but just don't do it. You need to use a completely separate area to wash animal dishes and prep pet food, entirely distinct from human food areas. And it probably goes without saying, but never let animals eat or drink off utensils used for serving human food.
Because these microscopic cysts are totally invisible to the naked eye and can easily be ingested if you touch your mouth with contaminated hands, your personal protective equipment is your primary physical barrier. You're required to wear protective clothing at all times in the facility. You absolutely must wear gloves when gardening or touching soil. And again, if changing litter trays is completely unavoidable, thick disposable rubber gloves are 100% mandatory.
Section 6. Managing exposure and symptoms. Even with the strongest shields in place, you need to know your emergency response protocols. This one is super straightforward but incredibly critical. If you or a colleague suspect you've been exposed to contaminated feces or any zoonotic pathogens, or if you start developing flu-like symptoms and swollen lymph nodes after handling sick animals, do not wait around. Seek medical advice quickly. Early detection and advice are paramount, especially if the person exposed falls into one of our high-risk categories.
By mastering the Toxoplasma life cycle, identifying the clinical signs in both animals and humans, and rigorously applying these strict safety and hygiene protocols, you aren't just preparing to pass an assessment, you are genuinely preparing to protect lives in your future careers. So review your notes, really understand the flow of transmission, and ask yourselves, are you ready to conquer Unit Standard 1989-4? I know for sure that you are. Great work today, everyone!